Hi, Julie.
Hello. Hi, John. Hi, Neil.
Hi, John.
Hi.
Hey,
All right.
we can hear you.
That's good.
Quite important. How you doing, John? You all right?
Yeah, not too bad. Not too bad.
Jolly good. Jolly good. Quite a short meeting this morning, wasn't it?
It was, wasn't it? I think it just shows you how much Peter rambles on a little bit.
Perhaps we should go on holiday more often.
Yes, exactly. Exactly.
Are you all right, Neil?
I'm very well, thank you. I'm very well indeed. We're, just still muddling on and doing all the things that we can. But yeah, no, we're good. We're good indeed. So can't complain. Good to meet you, Tom.
Yeah, nice to meet you. Yeah. Hi. Hi.
Oh, sorry. Yeah, of course we've probably never met, have you?
No, I don't think we have. No.
No, we haven't. We'd normally do a short hello ahead of time, but I know Laura and you have been in contact, and you.
Yeah.
All good. So Laura's talked me through what you're covering today. So we're honestly delighted to have you. So thank you for bringing that to us and sharing it with the group. We've got another great bunch of attendees. Still some people joining, but good attendance again. So
Excellent. Good.
There's a good audience for you. So thank you for making the time. As is normal, we'll probably start with John, and John can do a quick introduction. Of course, everybody knows Julie from the ICCM, and thank you, Julie, for making the time again for this. And feel free, guys, to keep the questions coming in. Once John's done a short piece, we'll ask you guys a quick question regarding your aspirations, your thoughts, and your what you'd like to see from the webinars as we roll on through the topics, and we bring more content to you. So think about what you'd like to see from us in the future. We're going to put that all into the mix and work on a plan with Julie to bring you more of what you want. So have a think about that. I'll ask the question shortly on the chat, and then you can just feed that through as and when you guys have anything. But we're keen to bring you what you want and what's valuable to you in your organisation. So probably with no further ado, John, if you wouldn't mind giving yourself a quick introduction and talking us through what you've got for us.
Okay, yeah, sure. Thank you very much, and thank you very much for inviting me along to this. Really delighted to do it. So just to introduce myself, I'm John Levitt. I'm Chief Executive of the National Association of Funeral Directors. I've not been in post that long. I joined NAFD at the end of 2018, so I haven't quite yet done 2 years in post. And whilst I knew I'd got challenges such as the Competition and Markets Authority and things like that to deal with, I had no idea that I would have to a global pandemic on the agenda for quite so soon in my tenure as chief executive. So it's been quite a challenging time. I'm also new to the funeral world, by the way. It's not. I came to that role. My background has been working for really sort of professional bodies and professional regulators. So I've worked with various professions and occupational groups, but not funeral directors or anything funeral related before. I think in terms of the challenges that we faced during this first wave of the pandemic, I think probably the easiest place to start is right at the beginning. And I remember back in early March, sitting in the NAFD offices at Solihull, in those days when we used to go to the office to work rather than my dining room, and getting a phone call from a funeral director who sort of said, we are going to be handling the funeral of the first recorded COVID death. What on earth do we do? Because there is no guidance. And particular concern was around guidance around personal protective equipment. And of course, this was the beginning of March, and the funeral director was absolutely right. At that time, there was no guidance available. Indeed, it wasn't until the end of March that we got any guidance, sector-specific guidance from Public Health England. So what did we do? Well, what I did in that circumstance, I signposted the funeral director to the Health and Safety Executive guidance that existed on PPE for SARS and bird flu, because the understanding that we had is that it was similar in terms of the risk of transmission and so on, and that was the best we really had to go on. But it was clearly an unsatisfactory situation, and it was a situation that wasn't resolved, as I said, for quite some time, not until the end of March. And then when we did get guidance from Public Health England, there were some apparent contradictions in it, which, and as Julie will well know, as DMAG, we wrote to Public Health England with a long list of issues saying, you know, this needs clarification. And then we had problems because the guidance from other public health bodies in Scotland, in particular the guidance in Northern Ireland, differed quite significantly, not just on cultural type issues, which you might expect it to differ on, but things like the use of body bags, which is around the use of transmission. So there was a real problem and a real challenge around a lack of guidance early on for us. And we took the view, and it was a difficult one for us, because it is very tempting as an organisation in that where there is that vacuum to start providing your own guidance. But on public health matters, we really didn't feel that we were able to do that, and all we could really do was signpost to other guidance as to what was available. That's not to say that we didn't produce guidance on other matters, particularly around helping funeral directors plan and risk assess and so on for their business. And quite fortuitously, we had for quite some time been working on a pandemic planning guide. Long before anybody had ever heard of COVID-19, we'd had this document in draft form and had been gradually working on it. So we accelerated our efforts to get it out and put it on our website. And just last week, I got some stats from our IT guys about how many times that document had been downloaded. And astonishingly, in March and April, it was downloaded 35,000 times, wow. Which is just unbelievable. And that just gives you an idea of the kind of traffic that we had going to our website. We were getting an unprecedented number of telephone inquiries to our office, hits on our website. We had so much traffic on our website, we were worried about it collapsing and had to we set up a microsite dedicated to COVID-19 to just help deal with all that traffic. So it was a challenging time, and as I said, not helped at all by the lack of guidance. The other big challenge, I think, was around if there was no guidance on what PPE people should be wearing. There was no PPE was the other challenge. Again, early on, we contacted and did a bit of a survey of the normal suppliers to funeral directors for PPE and asked them what the stock situation was. And it was quite clear that stocks were either non-existent or very, very low. And that was a challenge. Now, some funeral directors had thought ahead and had ordered in good stocks of PPE before the virus really took hold, but others hadn't, and they were, what we were getting is saying, we just can't get hold of any PPE. What are we going to do? So we had sort of did some thinking around this, and I think the only thing we really came up with, because we would obviously this was not limited to funeral directors. There was a national shortage of PPE, indeed a global shortage of PPE, and any supplies that were coming through were getting diverted clearly to the national supply, and not going to the normal commercial suppliers. So we ended up putting in an application to get supplies from NHS supply chain, to see if that, on a temporary basis, funeral directors and other funeral workers could get access to that supply. And I found myself, I mean, it's just bizarre, filling out an application form, ordering 50,000 body bags, 33,000 disinfectant wipes, 2,000 eye protectors, 200,000 aprons, 200,000 face masks, etc. And thinking, what the hell am I going to do if we get all this stuff? Where's it going to go, and how's it? Where are we going to put it, and how are we going to distribute it? And essentially, now that application was escalated all the way to Matt Hancock. It went all the way up through various committees of government, all the way to the Secretary of State, and it was successful. And to my great relief, although this caused problems, the way PPE was to be supplied was via local resilience forums. So I didn't have to empty the office and empty the garage and order vans to sort of go around the country. It was this was going to be dealt with by local resilience forums. But I think that in itself presented another challenge, because their performance in distributing PPE to funeral directors and other funeral workers was patchy. Some were very good, and some were pretty much told funeral directors to go away. We haven't got anything for you. So, and that is something that we've raised with government as a kind of a learning experience. That if you are going to rely on LRS for this sort of thing, there needs to be some consistency and some very clear messaging about who is entitled to have access to the national supply. I've just got another couple of issues to raise. I think, interestingly, capacity, which I think we all thought was going to be a big problem at the start of the pandemic, and was certainly a big concern of government, didn't turn out to be such a big problem in the end at all. And I think the sector coped extremely well. Funeral directors very rarely, from what I understand, had to access the temporary mortuary facilities that had been set up by local resilience forums. Some did, but it wasn't, in a lot of cases, they weren't accessed at all. And in terms of securing, in terms of getting the funeral done and getting crematoria slots and slots at cemeteries and so on, with the exception of a few hotspots where there were some difficulties, generally speaking, I don't think there were anywhere near the scale of the problems that we had envisaged there might be. So I really think the sector did that all worked really well. And I know a lot of you did important things like extending opening times, weekend opening, and so on, to help with that. I think the only piece of learning I'd take from that is that what I heard from funeral directors is that they struggled to persuade clients around having funerals at weekends, and I think a lot of the feedback we've got is that I know a lot of you opened up at weekend and those slots were just not used, even though you were very busy during the week. So I think I'd take that as a sort of learning point. We need to think about that if we're in this sort of position again. Should funeral directors put more pressure on clients to take weekend slots? that kind of goes against the grain of what they're all about, which is helping the family get what they want. Or is that just not the solution to capacity problems? So I think we need to think about that. And then finally, I just talk about financial issues, really, because I think what we've seen during the pandemic is a huge shift towards simple funerals and direct cremations. Now that's inevitable, I think, given the restrictions on attendance, etc., that have been in place. But that has brought with it, I think, certain, certainly for some funeral directors, some financial issues, because a lot of funeral directors structure their prices so that the margins on direct cremations and simple funerals are at the low end, and that they make their money on the more, on the blockbuster funerals, if you like. Now that is not such a problem, I think, when if you're a funeral director in an area where you had increased volume because of the pandemic. But of course, there were lots of areas of the country where the same restrictions apply, and there wasn't a particular uptick in volume. And of course, now we're sort of past that first wave. We've still got sort of a fairly restricted environment. People are still opting for simple funerals, direct cremations, rather than some of the other more sort of blockbuster funerals. And I think that is going to sort of affect the financial state of some funeral directors. They've also had increased costs, of course, over this time. PPE is a big one. I mean, whilst the supply situation on PPE has largely resolved itself, there's PPE out there now, it is still very expensive, and funeral directors have had increased costs in that area. They've also had increased staff costs, because obviously a lot of those who work for funeral directors are a number on the elderly side, have perhaps had to be shielding and so on. And so funeral directors have had to take on temporary staff and so on to provide cover. And we've yet to see, of course, whether these shifts in consumer behaviour towards simple funerals, direct cremations and so on are going to be permanent. Has COVID changed funerals forever? We don't know. Let's sort of, we need to wait and see. But I think this is certainly one of the issues that we have raised with the Competition and Markets Authority, because obviously they have investigated their market pre-COVID that could be very different to the market that emerges at the end of this. We don't know. It might all, return to what it was, but that might take some time, and it might never happen. We could see some permanent shifts here. So I think that's the other thing that I sort of finally highlight to this. So I think those were the main issues. I mean, I think the difficulty is, and as Julie would know, on DMAG, where we were meeting daily and having 2-hour meetings because there was just so much to get through at the time. So a huge number of issues arose, and we never struggled, I think, over March and April to fill our time. There was just so many issues to grapple with. But I think those, reflecting back on it, those are the ones that really stand out for me.
John, thank you. That's great. There's a number of good points in there. I've definitely got a few questions that I'd like to pick up on the back of that. And guys watching and listening, please type your questions into the Q&A tool here at the bottom, or indeed in the chat there. Julie, possibly over to you for some follow-up on what John said there first.
Yeah, I think I agree entirely with with John's main learning points there. And one of the things, John, very early on that we struggled with was the lack of modelling. So we actually had no clue what we were going to be facing. And I think if you remember, John, we were told early on it was anywhere between 20,000 and 500,000 deaths. And that, you know, that's a massive difference, obviously. And then later on, that was refined to imagine your worst winter, add a few and times that by 3 months. And that was all we got. That was all we were told. So we had no clue what the death rate was going to be, which made it very hard for the funeral directors and cemeteries and crematoria to plan. And in fact, John, you commissioned your own modelling, the NAFD commissioned their own modelling, which has been pretty helpful.
Yeah, that's right. It was really frustrating, and Julie and I were on weekly meetings with the Cabinet Office where modelling came up every week, and I think we kept saying, when are we going to get to see the modelling? When are we going to get to see the modelling? And it eventually became clear we were never going to get to see the modelling, and all that we were going to get were these very broad characterisations that, as Julie said, imagine your worst winter week, add a few to that, times it by 3 months. It was interesting. I went to see a firm that we've been using during the Competition and Markets Authority thing, a firm called Europe Economics, and about a completely different project. And we got onto the subject of modelling. And I sort of said, we're not getting anything from the Cabinet Office. And they said, well, we can do some modelling for you. Now, by this time, I have to say, we were over the worst of it in terms of the first peak. And so they came up with some modelling for us, which was very much around what might happen in terms of second waves, and that was broken down on a regional basis. And from what we've understood, I mean, it was good in a sense that we did it, because it helped push the government to give us a little bit more in terms of what their own modelling said. So I think what we were told is that the modelling that we had commissioned was broadly in line with what the government's modelling was saying around the risks of second waves, and particularly in terms of those areas of the country where there was a higher risk, the northeast, Yorkshire, northwest, and so on. But yeah, it was a huge challenge, and a particular challenge, of course, for our national operators, Co-op, Dignity, or whatever, who were trying to sort of do some, workforce planning around where the sort of the peaks might occur.
Yeah.
Sorry, Julie, were you going to speak?
No, I was going to say, yeah, that, I think it did help us understand a bit better. It's not, I mean, to be fair, it's not a simple equation, isn't it? Is it? And there were so many factors involved. How successful the lockdown would be, whether people would actually behave and follow lockdown or continue to take risks. So I can see it wasn't easy, but for me, I remember those early DMAG meetings, which went on late into the night sometimes, and just us all really struggling to get our heads round, just what are we facing here? What can we tell our members? So, and I think, the good thing that's come out of it is DMAG, and the fact that all the organisations are working so well together. That has been so important and so useful. We would all struggle individually to have a voice at government level, I think, but as a united voice, we do get listened to, and we still have government ministers, government departments come on to every DMAG meeting. Ministry of Justice are always there, and the other departments involved also join us regularly. So that gives you an idea of how well respected DMAG is at government level. So, and it's something we're all hoping will carry on if we ever come out of the COVID period. I guess it's with us for a very long time, but you know, when things get back to some sort of normality, we've proved we can work together very well, and we will continue to do that.
Yeah, absolutely, absolutely.
Guys, we've a question in from Kevin Watkins. Kevin says, has there been any guidance on if we should encourage mourners regarding the wearing of face masks?
Sort of. It's very mourning.
Yes. Yeah.
If I understand it rightly, John, from the Cabinet Office meeting this morning, the funeral director premises are going to be classed as retail. So people going into funeral director premises will be encouraged to wear face masks, but it won't be for the funeral director to police that. It would be a police matter. So there's no expectation that funeral staff will have to sort of confront people and challenge them on it. Mourners at funerals don't have to wear face coverings, but if they're travelling to the funeral on public transport or in vehicles with people that are not in their household or bubble, then they should wear face coverings. But at the actual funeral, in the crematorium or cemetery chapel, they don't have to wear face coverings. Is that how you read it?
That's certainly what I took from it. I think the other thing that we've got clarification on as well was on social distancing, in particular as to whether the 2 meters should still apply, or whether 1 meter plus, whatever the plus is, whether it's a face mask or whatever, could be used. And the clarification, and we'd had clarification from Public Health England, and the Cabinet Office backed this up, that for funerals, social distancing should be 2 meters and not 1 meter plus.
Yeah, and that's important, because that obviously affects the number of attendees. So you can't increase the number of attendees by going to 1 meter plus. You have to respect the 2 meter plus social distancing.
Okay, thank you. John, if you mentioned earlier in your piece there regarding the different guidance, and at the start of March, you know, there being almost that month gap between the first death and the guidance coming in late March, and the different regions of the UK giving different advice, not just culturally, but on, you know, transmission related topics like body bags, for instance. As we've learned more, you know, in the last few weeks and months, do you guys anticipate a lot more of that guidance becoming uniform across the regions, or are we for the, you know, very staunchly different positions on how we're going to operate, let's say, into the autumn or possibly a second?
The first thing I'd say is, you know, the guidance has definitely improved across all jurisdictions, I think. The first Public Health England guidance that we got had lots of, you know, there was just lots of question marks arising from it. And as I say, it came out, and then at a very similar time, the guidance in Northern Ireland came out, which was talking about double bagging, whereas the Public Health England guidance was basically saying body bags are optional. So a huge difference, you know. I think there has been a gradual coming together. I think there are still some differences, but I think there has been a convergence. And I guess, you know, we have to accept that there will be difference of opinions in the scientific community around this. I mean, and we're dealing with an unknown virus, and as things go on and scientific consensus starts to emerge on these things, I would expect to see the guidance be more consistent across the jurisdictions. I think the trouble is, any differences doesn't help when you're dealing with a very anxious business owners and a very anxious workforce who just want to do the right thing. And the nuances of scientific differences sometimes are just not very helpful in that context.
Yeah. Julie, anything you want to add to that?
Yeah, no, I'd agree entirely. It did get very frustrating to, be told one thing in England and another thing in Northern Ireland. It's very hard to sort of produce guidance then for our members.
Yeah.
You end up having to produce separate guidance for the 4 nations. I mean, we did raise this often at the Cabinet Office. Again, we do try. Believe us, we often get sore throats trying to get our points across. But it was made very clear that each nation has the right to make their own guidance. That's the whole point of devolved government. So nice though it would be if they all agreed. We have to accept that there's going to be differences sometimes. I think I'd agree with John. I think as time goes on, it's becoming a bit more, a bit similar across the board, isn't it? But there are some issues, obviously, with the easing of lockdown at different stages. So people who are sort of on the borders may find it particularly difficult. If you've got a funeral director sort of in the north of England who also covers Scotland, it must be really confusing for them. So I think we just have to accept that's how it is. And there's no point us screaming and shouting to get everyone to do the same thing, because that just won't happen.
Right. Okay, good. Thank you, guys. Another question here, Mushtaq Parker, and my apologies if I haven't quite got the pronunciation of that right. Question is, what guidance to crematoriums and cemeteries regarding test and trace?
Okay. Our advice at the moment is that you should actually consult with your local health protection team to see what information is required to be kept in your particular area. I mean, the guidance is that venues should gather the data. We're talking sort of all venues, not just funeral venues. So generally, it's the venue that has to gather the data. I know some crematoria are asking funeral directors to do that, which is not necessarily ideal, because the funeral director doesn't necessarily know who's going to come to the funeral, so can't always submit a list of people before they arrive. I'd be interested actually if anybody is actually collecting details at a crematorium or cemetery. But our advice is to consult with the local health protection team. It may be that they consider that if you're keeping the details of the applicant for the cremation or for the burial, they're sort of the leader of a group, and therefore you only need their contact details, because they should then be able to contact anybody else should there be an issue later. But it does seem to be very different in different parts of the country. I know in North Devon, for example, the health protection team there said that they don't require anything other than the fact that the crematorium will have the applicant details anyway. Whereas I know other parts of the country are asking for a lot more data. So consult, basically, ask your health protection team. And if anybody is doing it, it'd be interesting to know how you do that without disrupting the funeral. Do you stand at the door and take names as they go in, or as they come out, or how are you actually managing that?
Yeah. Right. Okay. All right. Thank you.
John, do you want to say anything on that? I know.
Yeah, I think that's right. This is another issue where there are different approaches across the country, and different authorities taking different views on it. I think Julia's right. There is a problem if the funeral director is asked to do it, because they don't necessarily know who is actually going to attend the funeral, and the nature of funerals is that people do just turn up. So that is a particular difficulty. I mean, our advice to funeral directors is to work collaboratively with them. With the crematoria and cemeteries on this. We don't want this to become a bone of contention as to who's responsible for what. Yeah. But I think that there is there is some guidance out there on that, and it's guidance that applies across all different sorts of situations. So, you know, if a group visits a restaurant or a group visits a pub or whatever, that they should, and that guidance is that the sort of minimum they should do is have the contact details of the lead person of the group, that if there is an outbreak, the venue can contact them, and then they can supply details as to who else was in that group. I think this is an issue where we ought to be pragmatic as possible, really.
Yeah, exactly. And I think the guidance says something like the venue should collect the details in a way that supports their business, or something along those lines, doesn't it? So I think it basically means if it's going to be really difficult to do and it's going to disrupt things, then, you know, just take the minimum amount that you need to. And as I say, I think, you know, the applicant for the burial or the cremation, you'll have those details anyway, so it shouldn't be too difficult. And, you know, the last thing we'd want to do is disrupt a service. You don't want to be standing at the door with a clipboard in a kind of very officious sort of way. Yeah. You know, we are still dealing with funerals and bereaved people here, so we still have to be as sensitive as we can be.
Okay, no, absolutely understood. Sheena Ratcliffe has asked, is there any guidance on where and when I can start witness scatter, as we are inundated with requests from families who argue, to John's point just now, that they can go to the pub yet can't scatter their loved one in an outdoor environment?
You can now have witness scatterings. It's still a little confusing as to how many people can meet in a group, isn't it? And again, I think that might be different in the different nations, so you'd need to check whichever part of the country you're in. But I know quite a few places have started to now do witness scatterings. I think, if memory serves me right, in England at the moment, up to 6 people from different families can meet outdoors, but up to 30 if they're in social bubbles and households. So I think, you know, if somebody wants to make an appointment, you would have to sort of ascertain how many people there would be from different households to sort of to say how many people can actually attend. Yeah. But certainly, yeah, you can now. I think the regulations were changed a couple of weeks ago, and the regulation said that crematoria must be closed except for funerals, and that's actually changed now. That's no longer the case. So you can now start doing other non-funeral related activities, but within the social distancing and the other guidance that's in force.
Okay, thank you. And there's a couple of the other guys there who are following up on that point, to Sheena's point in the chat there. So thanks for comments on that as well. From Ruth Carr, we touched on this earlier. It might be from a slightly different angle. Are masks now compulsory in a crematorium?
No. No. Short answer: no, they're not compulsory. Personally, I really don't see how masks could work at a funeral. You know, you have people who are crying, and, you know, when you cry, your nose runs, and I just think wearing a mask just wouldn't be appropriate, really. It would end up as a soggy mess, wouldn't it? Which would probably be breeding more germs than actually protecting people. I think so long as you can maintain the 2 metre social distancing, currently, until the government tell us otherwise, I don't think masks, if people want to wear them, that's different, but I don't think you should make them compulsory, and there's certainly, it's not a legal requirement. So no. Okay. Whether you want to make it a requirement for people who visit the office, again, you know, as with funeral directors, there is a sort of retail element to what you do in a crematorium office in terms of selling memorials. So your local risk assessment may be that you require masks to be worn. Certainly if you can't maintain 2 metre social distances, or you haven't put in screens or other protective protections, then it may be something that you want to consider, but not with the funeral service.
Okay, all right, thank you. John, one for you if we can. You'd mentioned there in your piece early on regarding FD struggling to convince clients to take weekend burials, for instance, despite those facilities being open. From your point of view, what does the opportunity look like? Or where is the opportunity for closer collaboration between the funeral directors and the crematorium and cemetery facilities? If this came back again, how might we do it? How might we improve on the phase one, if you like, of COVID-19?
Well, I think first of all we've now got a lot of experience, haven't we, having gone through this, and certainly these sorts of issues are exactly the sort of things we've been discussing at DMAG, so I think what I would say is, I mean, DMAG's a very, very good forum for that, because I get things escalated up to me from my members. Julie and Brendan from FBCA and so on get stuff escalated up from their members, and we often find that there are where tensions have arisen, that there's misunderstandings and so on, and there are things that we can sort of resolve, and actually then put out guidance to our members. We had an issue where I became aware, and I can't remember if it was you, Julie, or it may have been Brendan Day, had raised the issue that that some funeral directors had been effectively lying to their clients about the availability of crematoria slots. And we did a bit of a bit of work around it, and it became quite clear that they were saying that slots weren't available when they were, presumably because it didn't suit their own business to do the funeral at that time. So I was able, as a result of that, to put out a fairly firm message to our members. And they shouldn't be doing that. It's actually a breach of our code of practice to do that for a start. But if you do that, you are going to get found out. So that's one of the areas. DMAG is a really good forum for sorting out some of those issues. And the other thing that we have been exploring, and I don't know if we will be able to take this further, but because we were hoping to get some government support around it, was about having some kind of online portal which would sort of show the availability of crematoria slots. And I know Julie in particular did some sort of work on the scope and specification for that. I think the issue is probably going to be around funding, I expect, Julie, for it. I think that's...
Yeah, partly funding, and there didn't seem to be buy-in from some of the more private crematoria, who I think were worried that people would use it for sort of commercial or to gain advantage. They were reluctant to put all their information out to sort of scrutiny, I suppose. So without buy-in from everybody, it wouldn't work. It would need everybody to agree to share their data. So I think it's a great idea. I think it's a wonderful idea, but currently it's kind of on hold because, partly lack of funding. Because we were hoping the Cabinet Office would actually take it on and use their resources to develop it, but they basically said, good idea, go and get on with it. Because we don't have the resources either. And as I say, I think the biggest issue was that there was reluctance in some quarters to actually share data. So maybe one day, as technology improves, maybe I think it would be quite a challenge, wouldn't it? Because there's different software out there, different crematorium software, as Neil will know, and it would be hard to try and find a way of combining all the different programs into one usable kind of front end. So, but if in Australia, then there is now a kind of central booking system, so the funeral director just has to sort of type in what they're looking for, and a list of available crematoria, and the times will come up, and then they can choose which one they want. And I can see, you know, that would be a really nice tool, wouldn't it, for for people.
Yeah, that's what we were. That's what we were sort of. That was the kind of ambition, because I think where there were sort of capacity issues at some crematoria, I think you know, Julie, like you were aware that there's another crematoria not so far away had available slots, but the funeral director wouldn't necessarily know that, and wasn't then able to advise their client about that as an alternative. And I think that was the idea behind the online portal. It would provide that information to help the funeral director advise their clients as to you know, what was available.
There are some crematoria, of course, who actually do show their availability online, and some have online booking systems. But I think, you know, those that show it is really useful, because you can just go onto the website and say, all right, yeah, there's several slots available 2 weeks on Friday. You know, just you know, it could be a good marketing tool for people as well. So it's worth thinking about. If you don't already share your diary online, it might be worth thinking about. If every crematorium did it anyway, then we wouldn't need a portal necessarily.
Okay, good points. There's a question in here from Samantha Smith. If the council makes it compulsory to wear a face covering during any of their public in any of their public buildings, including the crematorium, can it be challenged as it's not actually compulsory to wear one?
Oh, that's a good question. Probably, because at the well, actually, I haven't seen the face covering regulations. I think they were due out at 2 o'clock. Have you seen them yet, John?
No, I looked at about +2 and I couldn't find them yet. So
yeah, because at the moment it's guidance. So unless it is compulsory in law, then I guess any independent adoption and forcing of people to wear masks could be challenged. Yeah. I mean, if the council does insist on it for their buildings, fair enough, but I'd ask them to reconsider the crematorium part. As I said, you know, if people are crying and what have you, it's really, you know, it could be really horrible for them. So if you've got any sway at all, I'd ask them to reconsider, look at it from a risk point of view. If you can maintain 2 meter social distancing, then actually is a mask going to make a lot of difference. So yeah, I would challenge it myself, I think, if I was working for an authority and they tried to enforce it at the crematorium. Right.
Okay, great. I just had another look here on a different machine. I just see on the BBC News there is 38 minutes ago there was a new article going up regarding new guidance for England at least. So I'll try and paste that into the comments here. You guys can see that, but you'll find it with a quick search.
Thank you.
So, yeah, no worries. That's out. Okay, guys, we've about 10 minutes left. So if there's any final comments, questions, please get them in. John, I would like to ask you, I mean, given your background, being, you know, you mentioned you're 2 years into your post here, you've a rich experience from other public bodies and regulatory environments and so on. So not even necessarily around COVID-19, but given the experience you've got and you know, you're looking at this sector with fresh eyes almost, what's your interpretation of the opportunity for the profession in the next 5-10 years? You know, what can the profession do to you know, what inspiration can it take from other sectors to progress its agenda?
I think there's one of the reasons I was particularly interested in taking this job is that I became aware of the work that the CMA was doing around the sector, and I think whilst there are clear threats associated with that project, there are also some very, very clear opportunities. And one, I think, the real opportunity that I see arising from that is there to be regulation of quality and standards. I think is something which would really help, in a sense, professionalise the sector further than it already is, as long as that regulation is proportionate and so on, and based on the you know, based on the areas of highest risk, really. From my point of view, I hear from members quite a lot that they will have funeral directors in their area who are not members of a trade body, who are operating, you know, don't operate outside of any kind of code of practice or anything like that. And of course, they are doing so completely legally. The idea that there should be some kind of statutory underpinning to regulation, which basically says you can't do that. That if you are in business as a funeral director, you do need to be subject to a code of practice. You do need to be subject to you know, complaints system and so on. And also, you know, that there should be things like compulsory continuing professional development, that it shouldn't just be something that you volunteer to do, that it's something that is required as part of your job role. So I think there are huge opportunities around that in really sort of ramping up standards, and I think that's what sort of excites me around the possibilities here. I've just been doing a big project on revamping. NAFD provides qualifications for funeral directors, and we've just been looking again at those qualifications and really thinking about, because at the moment, well, we've got a healthy number of people that take those qualifications, but we're scratching the surface in terms of the funeral work, the entire funeral workforce, I have to say. So I think there's lots of really exciting opportunities that if qualifications and CPD do become compulsory, huge opportunity for organisations like NAFD, ICCM and so on, in making sure that we've got a really well qualified, competent and professional workforce. I think we have largely, but there are certainly gaps in that, and where there are gaps, I think there are quite some areas of quite serious concern.
Okay, thank you, John. I appreciate that. And probably, if Julie, if you don't mind, you from a slightly different angle, but with many years respectfully in the profession. Oh gosh, stop digging, Neil. But what's your take on you know, the opportunity for the sector from your point of view? I think you're on mute, Julie, or you're not. I'm not sure.
No, I'm not. Can you hear me?
Yes,
cool.
gotcha.
Yeah, absolutely. I think we're at a really exciting time, actually. COVID has thrown everything into kind of a weird place, hasn't it? But pre-COVID, you know, the CMA report, for the first time, some serious scrutiny of the funeral sector. COVID has thrown everything that we thought we knew about funerals into chaos. I think the opportunity to start really listening to people. What do people really want for funerals, rather than what are we providing? You know, is the traditional sort of 40-minute slot at the crematorium really what people want? Do we need to consider other options? The other massive issue for me is the environmental agenda. The funeral sector is pretty dreadful. You know, we sort of pick at the edges of it, don't we? And we do green things here and there, but generally it's not a very environmentally friendly sector. And I think we need to get much better at working with the environment and stop sort of doing some of the horrendous things we are doing. you know, if you thought about it, if you were working things out from scratch, would we really cremate? Would we really bury? Would we really bring stone in from halfway around the world? You know, so I think we need to have a really good look at what it is we're doing, what it is that people want, and how we can deliver that. And good luck to John. I think we all sort of became chief executives of our respective organisations about the same time, more or less. You and me and Brendan. So it's kind of, yeah, it's a really good learning opportunity, I think, to take our respective organisations forward.
Very good, thank you. Right, so 2 questions that have just come in with a few minutes, and then we'll be quick. So from Sheena, should we be following the easing of lockdown in England guidelines for cemeteries and crematoria? If so, have we yet moved to stage 2, or are we now allowed to scatter, or have I missed it, and are we even further along?
Yeah, I think if you're Sheena, if you're referring to the guidelines that we published, I think there were 4 steps easing out of lockdown, which were not meant to be cast in stone at all. It was just a kind of some scenarios of how it may go, depending on obviously the easing of lockdown generally. I think we're sort of between stage 1 and 2 really at the moment. So we've got some easing, but there's still some things in place. So as I say, it's not hard and fast. There may be some things in 1 and some in 2 and even some in 3 that we can do. But generally, we're still sort of fairly early on. So yeah, if that's the guidance you mean, then sort of use it as a guide, but don't, you know, it's not cast in stone. And there may be some backwards and forwards. Obviously, Leicester is very much still in stage 1. So, and that may well happen. There could be sort of jumping between the stages as we go along, and sort of experience more local lockdowns. Right.
Okay. Thank you. Okay, Mushtaq, I see you a question there, and between Elaine and Sophia, I believe you're set with the stuff, the questions there. If not, fire a question in afterwards to myself or to, and I'll try not to answer it because I won't give you the right information. I'll get that across to Julie or go to Julie herself. That would be awesome if that's not already answered. Okay, John, maybe just to you for some closing comments on as we round off here, and then off to Julie, and then we'll let you get on to your 4 o'clock meeting.
Well, no, thank you. Well, first of all, thank you. I think it's been really interesting discussion. And these are just such, you know, they're both challenging but also very interesting times, and I absolutely agree with Julie. This is a time to sort of rethink real opportunities around rethinking and making sure we are giving people what they want, and not just sort of offering them some sort of, you know, bog standard package which everybody feels that they must have. I think we need to sort of move away from that. And I absolutely agree with Julie on the environmental points she made as well.
Right, thank you very much, John. Julie?
Yeah, just again, to thank everybody for joining in. It would be very sort of sad and lonely if it was just the 3 of us chatting among ourselves. So thank you for joining in and your contributions. It's great. I love the questions because it makes us think, which is really good. And I hope it's useful. And if there is anything that we haven't answered, you can always contact myself or my colleagues, Sophia and Matt. Our contact details are on our website. And again, thank you for all that you've done throughout the period. I would encourage you to work with funeral directors. You know, sometimes there's areas where, you know, the relationships are not all that good, but please work at it. They're not bad people, are you, John? You're all really nice. And you know, for the sake of the bereaved people that we all serve, we need to have those good communications and good relationships. So please work at it. And thank you for all you've done. Look after yourselves. Certainly as we're coming out of the kind of really busy period, it's a time to really focus on our own health. Make sure you take leave. It's important to take breaks. Because if you are not in a fit place to look after other people, then your service will suffer. So look after yourselves, and hopefully see you in a couple of weeks.
Absolutely.
So thank you, Neil.
Yeah, Julie, thank you very much. John, thank you so much for making the time. Everybody have the good rest of your day. Enjoy Friday and have a good weekend, and we'll see you all soon. Thank you.
Thank you. I'll see you at DMAG, John.
Yeah, see you in a minute.
Thanks, everyone.